Okay, let's unpack this. You see your dog, maybe after a run, maybe just waking up, and there's a little hesitation, a limp, and your mind just races, doesn't it? Is it bad? Are they hurting? What does it actually mean when they limp like that? It's a big worry for owners.
Oh, absolutely. It's a really common concern. And that limp, what we technically call lameness, well, not really a disease on its own.
Okay.
Think of it more like an alarm bell ringing. It's a sign, usually pain, sometimes weakness, affecting a leg.
A sign of what, though? Like, what could be causing it?
Well, it could be almost anything involving that limb. We're talking bones, joints, muscles, nerves.
Wow, okay.
Yeah, or even, tendons, ligaments. Sometimes even just a problem with the skin or a nail.
Yeah.
Basically, something's stopping them using that leg normally.
That alarm bell analogy is good. It tells you something is wrong, but not the specifics. So let's dive into that. We want to explore all the different reasons why a dog might start limping.
Right, because it could be really varied.
Yeah, and look at whether it came on suddenly or if it's been creeping up slowly, and, help people figure out, maybe worried owners, maybe even new vet students, how serious it might be. When do you need to act?
Exactly. Sometimes the cause is, well, pretty obvious if you look closely.
Like stepping on something.
Precisely. A sharp stone, a bit of glass, a thorn, maybe even just a torn toenail. You'd be surprised how much fuss a tiny splinter between the pads can cause.
Oh, I bet. They can be quite dramatic about their paws sometimes.
It really can. But it's not always something so simple on the surface.
Right. What else are we looking at?
Well, this is where it gets interesting. Beyond those obvious things, the range is huge. And, while a really bad limp, like holding the leg right up, obviously gets your attention.
Yeah, you can't miss that.
Exactly. But sometimes some really serious things like maybe early arthritis or even certain tumors might start with just a very slight limp. Maybe it even comes and goes.
That's tricky. Easy to dismiss, perhaps.
Very easy. And those subtle signs can sometimes be the most important ones to catch early.
Okay, so we've got the sudden, obvious things like cuts and thorns. What about underlying stuff? Maybe things that develop over time, especially in younger dogs.
That's a great area to touch on. In young dogs, particularly larger breeds that grow fast, we see developmental problems.
Like what?
Things like hip dysplasia or elbow dysplasia. These are often genetic, where the joints just don't form perfectly. The ball and socket, maybe they don't fit quite right.
Ah, okay. Like bad mechanics.
Sort of, yeah.
Yeah.
It causes rubbing, pain, and often leads down the road to osteoarthritis, which is that degenerative joint disease.
Right, the wear and tear arthritis.
Exactly. But it's not just dysplasia. Young growing dogs can also get something called Panosteitis. People sometimes call it growing pains.
Growing pains, really?
Yeah, it affects the long bones. And the weird thing is the pain can actually shift. One week it's the front leg, the next it might seem like it's a back leg.
Whoa, that sounds confusing for an owner trying to figure it out.
It definitely can be. And then, of course, you have the more traumatic injuries.
Like breaks.
Yeah, fractures from accidents, falls, or serious ligament tears. A really common one we see, especially in active dogs, is tearing the cranial cruciate ligament in the knee. Sort of like an ACL tear in humans.
Ouch. Okay, so loads of possibilities. If you're an owner seeing this, how do you even start to figure out what's going on before you call the vet?
Good question. Observation is key. First, how much weight are they putting on it? Is it totally non-weight bearing, like a three-legged hop, or just a little bit of a head bob when that leg hits the ground?
Okay, watch how they walk. What else?
Look for obvious signs. Is there swelling? Does it feel hotter than the other leg? Can you see a cut, or does the leg look, bent strangely?
Right.
And think about their overall behavior. Are they still acting normally otherwise? Eating, playing, or are they hiding away, seeming really down? And importantly, how long has it been going on?
Duration matters.
Definitely. If it's mild and goes away within, say, 24 hours, maybe it was just a tweak. But if it lasts longer than that, or if it's severe right from the start, or suddenly gets worse, that's when you need to get it checked.
Okay, that makes sense. So you make those observations, you decide it's time for the vet. What happens then? How do they solve the mystery?
Well, they start with everything you tell in your observations are super helpful.
Yeah.
Then a really thorough physical exam is crucial.
Feeling the leg?
Feeling the leg, yes. Watching them walk and trot, carefully manipulating the joints, feeling the bones, muscles, checking for pain responses, swelling, any instability, reduced range of motion.
It sounds quite detailed.
It has to be. And connecting this to the bigger picture, that hands-on exam often points us in the right direction for diagnostics. We might need x-rays next to look at the bones and joints, see if there's a fracture or signs of arthritis, maybe that dysplasia we talked about.
Right. Imaging.
Exactly. And for things like ligament tears or maybe more subtle issues, sometimes we need more advanced imaging, like an ultrasound or even an MRI. The whole goal is finding that root cause.
Because you can't treat it properly if you don't know what it is.
Precisely. Treatment has to target the underlying problem for the best chance of success.
So what does this all mean for the listener? I guess it means really tuning in to your dog, right?
Absolutely. Pay close attention. Dogs can be incredibly stoic. They often try to hide pain.
Yeah, they don't want to show weakness.
Exactly. So that limp you almost missed, or the one that seems to come and go, it could still be significant. It might indicate real discomfort or an underlying issue that needs addressing before it gets worse. Your observation is so important.
It's the first step.
It really is. And the main takeaway, I think, is don't wait too long if you're worried. Any limp that sticks around for more than a day or so, or any really severe sudden lameness, especially if the limb looks broken or is dangling, or there's major swelling, needs professional veterinary help.
Get it checked out.
Yes. Understanding the possibilities helps, but the vet visit is key. Your observations help us choose the right tests, make the diagnosis, and then figure out the best treatment. That might be rest and safe pain relief, or it could involve surgery, physical therapy. It all depends on the cause.
The goal is getting them comfortable and moving well again.
That's always the goal, getting them back on all four paws, happy and pain-free.
Great advice. And just a necessary reminder for everyone listening, this chat has been for educational insight. It's definitely not a substitute for professional veterinary advice.
Absolutely. Always consult your certified veterinarian for any health concerns about your pet. They're the ones who can properly diagnose and treat your dog.